Let's now bring in Dr. Natalie Azar. So, Dr. Azar, let's start with the boosters. Pfizer says a booster vaccine dose will add an extra layer of protection against the virus. Dr. Anthony Fauci went on CNN yesterday to talk about whether people even need one. Let's listen.
What the CDC and the FDA was saying, Jake, is that right now, given the data and the information we have, we do not need to give people a third shot, a boost, superimposed upon the 2 doses you get with the mRNA and the 1 dose you get with J&J. No, there's a lot of work going on to examine this in real time to see if we might need a boost. But right now, given the data that the CDC and the FDA has, they don't feel that we need to tell people right now you need to be boosted.
All right, so in the last year and a half, we've gotten very familiar with Dr. Fauci's thinking. Why is he pushing back against the booster, at least right now? And if we do need to have boosters, who might end up getting it first?
Well, that's right, Joe. And, you know, Dr. Fauci's position has always been the same, and that is that the guidances will change if the science changes or the evidence to suggest, in this case, that your immunity is waning. And according to him and according to us in medicine and in science and in public health, the evidence that your immunity to vaccination has waned is just not there yet clinically. And there's a very important distinction, right? There are we check for decreasing or waning antibody levels in the blood, and we are seeing that. That's to be expected. And the Pfizer release last week stated, look, if we give a booster, the antibody titers go up 5 to 10-fold. But the issue is, does that actually translate into something clinically meaningful? We've spent the last number of days reporting on the increased cases of COVID in this country occurring in unvaccinated individuals. So it'll be very interesting to see what Pfizer has to say today. In terms of who needs to get a booster, well, certainly older individuals and people who are immunocompromised are going to be at the front of the line for boosters, not if you are generally healthy, the general population who is younger and doesn't have medical conditions that can dampen the immune response to vaccination, Joe.
Dr. Azar, let's talk about masks. The coronavirus, we know, thrives in the fall and the winter. Some health experts have warned that means Americans will need to mask again indoors when the weather cools down. I mean, what does that mean for vaccinated Americans?
You know, I think that everybody needs to be very, very flexible in their thinking about what's going to happen to them. I think we are definitely going to see regionally this reinstitution of mask mandates and even some distancing and decreasing capacity. I think we're going to see that very, very urgently in the fall in the areas in the country that are unvaccinated. But, you know, I like many of us in the Northeast, in the tri-state area, we have very high vaccination rates, and we're enjoying a bit of a normal summer, and I'm enjoying every day as that is, but I am fully prepared for those conditions to change in the fall when the weather gets cooler and we go inside. And if we do start to see infection rates increasing, we all need to be prepared to put that mask back on inside.
All right, Dr. Azar, thank you so much. Appreciate your expertise as always.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.